Epidemiologist Professor Salim Abdul Karim also believes there's no basis for the ban, as the variant has already been detected in at least 15 countries globally. He adds that existing vaccines are probably effective against Omicron.
Is our current treatment still effective? Yes, smiley face, because we know that most of the things we use in our standard treatment protocols should be effective. There's one area that's not clear, and that's on monoclonal antibodies, and that remains to be tested. We don't really widely use them in South Africa, so they don't really impact on us. There's new potential treatments coming into play.
Well, let's stay then with a slew of travel restrictions following the identification of the Omicron variant. The risks associated with this strain are largely unknown at this stage. Scientists still trying to better understand this variant. Well, for more on those travel restrictions and whether they are the answer to stopping the spread, we're joined by Tackling Infections to Benefit Africa Director, Professor Mark Wilhouse, and the Johns Hopkins University's Infectious Disease Specialist, Dr. Amesh Adalja. Good evening to both of you, and thanks for your time tonight. Professor Wilhouse, let me perhaps begin with you. When we look at these travel bans that have been imposed literally from different sides of the globe, are they the answer? Is this the direction that the world should be moving in as a response to try and curb the spread of COVID-19?
Well, I agree with the World Health Organization and the director of the World Health Organization Africa region that they are not the way forward. We can see this. The horse has already bolted. This variant, the Omicron variant, is already in many countries internationally and undoubtedly will be found in others soon. In the UK today, we've had our first evidence of community transmission. So the variant has already arrived, it's already spreading. And so I can't see, like the WHO, that the travel bans have much effect. What I can see is there's a very great need to test everybody who might be carrying the Omicron variant, and that includes travellers. So I do support that element of the policy very strongly. But an actual travel ban, no, I don't think that's going to have much of an effect at this stage.
Dr. Adalja, let me come to you. When one looks at the responses from multiple countries, it very much seems to be knee-jerk reactions. In South Africa, part of what has been said by our scientists here is that there is no scientific standing for these decisions to impose travel restrictions or even lockdowns, effectively banning people from traveling to various countries. Why do you think then that politicians are continuing to respond in the way that they have been?
Politicians respond in knee-jerk fashion. They often don't respond to the scientific or medical evidence. They have this idea that they have to be seen as doing something, even if what they're doing is completely wrong, because then they can say, I tried to do everything. And they think very short range. They don't think about the long-term consequences of their actions and what this does to a country like South Africa, to penalize them for really excellent science and alerting the world to this variant. So this is a perpetual tendency of politicians to not follow the science. We saw it early on in the pandemic, and we're seeing it again. I think it's really inexcusable this late in the pandemic that they're turning to these blunt tools that don't work and have very negative consequences.
Professor Wilhouse, one of the things that we have seen is a criticism, particularly of the G20 countries, because at the recent meeting, there was a lot of commitment around not just, the need to increase vaccine equity across the world, but also that the approaches to how governments respond to the pandemic would be different. So the fact that when there are these responses, they seek to stigmatize, they seek to ostracize, what does that say about the state of the world, really, when it comes to this pandemic?
Well, as we just heard, what we're seeing is a knee-jerk reaction that isn't strongly supported by the science. At this stage of the pandemic, we have the tools in place to manage outbreaks of COVID-19, and we have effective treatments, and we also, of course, have the vaccines that stop the spread and particularly protect us against disease. So we don't need these crude measures. I don't think they're appropriate at this time. So I agree, it's a knee-jerk reaction.
What is the better way to respond, Professor Wilhouse?
in general, we have to move from stopping activities, whether that's travel or whether that's social activities within our own countries, going to work, going to school. We have to move from stopping those activities to making them safe. We know how to do that, things like mask wearing, things like regular testing, things like physical distancing where that's appropriate in managed environments. We know all this, so we can shift now, today, if we want to, from not banning activities, but making them safe. And that's the way that we will all be able to live sustainably with this disease as we go forward in the coming months and years.
Dr. Adalja, one of the things that you've mentioned is how generally part of the reason why we do have these bans is that they give people a false sense of security. Do you think that that's a mind frame that we're going to need to get out of, including just as citizens of countries, for what the expectations on our governments might be when we do hear news of another variant, because this is going to be life as we know it?
Exactly. I do think we have to educate the general public to understand that this virus isn't going anywhere. It is going to become endemic. It will be with us 20 years from now, and it's going to continue to generate variants. And what we have to do, just as Professor Woolhouse said, is reduce the harm the virus causes by using common sense measures, masking in high-risk conditions, in high-risk situations, vaccinating as much as we can, antivirals, rapid diagnostic testing. All of those tools allow us to tame this virus, to live with it, because we have no choice whether or not we live with it or not. We can do it better by using the tools of science to defang it, to make it much more tame, or we can continue to use these blunt tools that have so much disastrous negative consequences and really restrict people's movements. I think the answer is always going to be science and harm reduction, just like we've done with HIV and other infectious diseases that we deal with. We've got to change people's mindset that there is no COVID-0. This is all about harm reduction and risk calculation.
Professor Woolhouse, let me perhaps begin to wrap up with you then. Transparency has been a key subject from the beginning of this virus, and yet we very much get the sense that countries like South Africa are now being punished for being very open and transparent with not just the country, but with the rest of the world. Do you think that that is going to change? So when other countries look at the reaction as what we're experiencing now, do you think that that will change the minds of scientists to come forward with whatever it is that they're seeing?
Well, it's not just South Africa. Of course, our colleagues in Botswana, in Gaborone, were actually the first to alert the world to this new variant of COVID-19. And they've also been put under bans, even though there aren't that many cases in Botswana now. And if it's any consolation, I'm sure it won't be to your viewers, but the UK has been exactly this position a year ago when the Alpha variant arose within the UK. And what happened then was immediately there were travel bans put on people coming from the UK. And as we've been discussing throughout this segment of your program, the future is not to resort to these kind of knee-jerk reaction measures. The future is to learn to travel safely. And that does mean accepting that from time to time there will be new variants, so we are going to have to manage those as and when they arise.
Dr. Adalja, let me come to you then also to wrap up with you. It might be easier to criticize, what other countries are doing, but within countries we also, of course, see varying levels of lockdowns and restrictions. Do you think that ultimately we are at the point now where imposing strict travel restrictions within countries also needs to come to an end as a response to trying to curb the spread of the virus?
I do think that's the case, because just as a travel ban internationally is not going to be effectual and has negative consequences, an internal travel ban will have the same or even more, because we know it's unlikely that one province is spared or one state is spared while another is not. This makes no sense. It creates a lot of divisiveness, and we've got much better tools to be able to identify who is infected, which activities are risky, which ones are less, and make things safer without resorting to blunt tools that have so many cascading negative impacts on people's lives that they are not worth it.
Let's leave it there for tonight. Dr. Amish Adalja, he's with the Johns Hopkins University. He's an infectious diseases specialist. And, of course, Mark Woolhouse, the director of Tackling Infections to Benefit Africa. It's a research partnership between the UK and Africa. We'll leave it there for tonight. Let me thank you both for your time.